This is partly how I got into functional medicine. My dad died of colon cancer, and I was chronically ill. And I was a chiropractor, and I was so sick. I work out of my house, and I was so sick that I would go up in between my patients and I'd go lay down. And I had seen a lot of people, spent a lot of money, and I couldn't find anybody to help me. And I was sick, really, really sick. And so I went back to school, because I thought, physician, heal thyself, right? No one's helping me, I'm going to have to figure this out on my own. And so this is how I got into the aggressive functional medicine practice that I have today, because I had severe gastrointestinal issues going on. I had 5 parasites, I had candida, my stress level, my dad had died and I took over his practice, and I had been to Mexico many, many times, and the tequila didn't kill it. I tried, but... and so gastrointestinal is near and dear to my heart. I wrote a paper and had it published on parasites and how to get rid of them, because I had homocyst blastocyst, and I tried for 7 years to get rid of it. And so I personally have a lot of experience with gastrointestinal conditions, and I'm going to tell you something: you can't have health without GI. It's the end of the road without healing gut issues, and if you have any digestive issues at all, if you're not having regular bowel movements, if you're not digesting your food, if you have heartburn, if you have any kind of bloating, those things are not normal. You're not supposed to feel your digestion. It's supposed to work below the surface of your brain. You shouldn't have discomfort unless you're eating really crappy food. And so the digestive system starts at your mouth and it goes all the way down to your anus. And if there's any problems along that entire pathway, it's going to affect your health. That's the end of the sentence. We can go home now. No, I've got more to say than that, of course. As I said, there is a book out there called The Second Brain, and it works without neurological input. It's a very smart organ. It has a tough job. It digests over 2 tons of food in its lifetime. And in today's society, it has to discern between the good and the bad, which is not easy. And so it's got a really, really hard job. And it is controlled by your emotions. So when you have a lot of stress in your life, here's that stress word again, your digestion isn't going to work. I don't care what you do from a functional medicine standpoint. I don't care what kind of herbs or homeopathic or digestive enzymes or food you're eating. If you are emotionally out of control, you are going to have poor digestion. So meditate, deep breathing, those kind of things really will improve digestive function. These are the different types of conditions that are labeled under digestive conditions. The symptoms through the gut will cause symptoms throughout the entire body. If you have gut inflammation, you have leaky gut, you have things going on in your gut, you're going to have systemic symptoms. There isn't any other part of your body that you're going to have problems with. And a lot of times you have pain in your joints, you have pain in general because you have inflammation going on. The gut affects the entire body, so it affects all of these, et cetera, et cetera. I didn't have enough space. I could have put slide after slide. Your gut affects every health condition. It's where I start with almost every one of my patients. 1/3 to half of all adults have digestive issues. I think that number is much higher. These typically, my things come off the CDC. 69% of people report having at least one gastrointestinal thing, and it's a huge business. And it doesn't have to be. I mean, digestion is a functional process. When you eat food, it's supposed to functionally go through your body, provide nutrients to your body, provide calories to your body, and it's supposed to do its job without being heard from, so to speak. So the brain starts this process. We in America don't sit down and eat. We eat in our cars, we run, we have stressful conversations during dinner. we have lots of things going on, and so our brains really control and start digestive process. So when you smell food, you see food, you're cooking food, it tells your brain to start making hydrochloric acid to produce the acid in your stomach, which is the beginning. You start producing amylase in your mouth, which helps break down the food, and then we start the digestive process immediately when the food hits your mouth. So the brain is the first thing that happens when we start digesting food. And you know, it starts producing all of these things, and without this proper stimulation, the digestion can't do its job. The main focus for eating for assimilation, I'm going to talk about some words and I'll define them in a minute. But the mouth chews up the food and liquefies it. We don't chew our food enough. I'm guilty of that as well. Your food is supposed to be liquefied in your mouth and mixed with the enzymes inside your mouth. We chew a couple times and we swallow, which makes then the digestive system process much more difficult. And a lot of people will sit with a big glass of water next to them and they'll wash their food down with the water. And the problem with that is our digestive enzymes are meant to break our food down, and when you dilute it with water and liquids, you're not really allowing your digestive system to properly function. And so this is a very important process for us to be able to chew and mix the enzymes in with our food. The reason the esophagus is important is there is valves on each end of it. So when you go to swallow, the food goes down. Right before it hits the stomach, there's a sphincter there. It opens up, and then the food dumps into the stomach, and when you're done eating, it closes. And when you get acid reflux, there's something wrong with that sphincter. Okay? So when the food comes down in the stomach and it hits the stomach, their brain has already told the stomach to make acid. Okay? And then the acid then starts mixing with the food. Okay? And so the stomach at rest, pH sits at about a 5. And when you eat food, the pH then has to get down to a 2.5 for those sphincters to close. Okay, so the top sphincter and the bottom sphincter have to close when the pH with the food, it's called the food bolus, gets mixed in with the enzymes inside the stomach. And the parietal cells inside the stomach produce the hydrochloric acid. Now I'm telling you all of this because I'm going to get to that medication I talked about earlier again. And so it's very pH dependent, the stomach is, and the esophagus. And so if you don't have the proper pH in the stomach, what happens to the food? You know, I remember as a kid, I was in science class and they took a piece of steak and we poured Coke on it. And it eroded the steak away. Hey, did anybody do that? Yeah. So protein requires acid to reduce it from its complete chain down to an amino acid that can cross the gut barrier. So if you don't have acid in the stomach and you eat a steak or a chicken or whatever you might eat that's high protein, you have to have the acid to break it down into the amino acid chain to cross the gut. Okay, here's where we're dealing with the functional medicine piece again, is that this is the biochemistry and the function of the gut. Okay, so a patient comes into you and they say, oh man, I've got acid reflux all the time. And I say, okay, what are you eating? We go through the whole process. And their doctors put them on the anti-acids and the anti-H2 blockers, which block the production of acid in the stomach. And I'm going to tell you right now, when you read the clinical research and you do testing on the stomach, they drop a little capsule down, they test the acid levels. People don't have too little acid. They don't have too much acid, they have too little acid. And here's what happens. When you don't have enough acid, the pH in the stomach doesn't drop to 2.5, and then the sphincters don't close shut. So what happens? The food sits in there, it doesn't have the acid to break, it swells up, and then the acid goes to the top of the food bolus. And the sphincter is not closed. So then what happens to the acid? It goes back up into the esophagus, which causes the acid reflux. That's the symptoms that you're having. So what does the doctor do? Well, we got to control that acid. You got acid up in your esophagus. So they give you a drug that reduces your ability to produce hydrochloric acid, which is what you need to digest the food. So I don't understand how it is that you can give someone an anti-acid H2 blocker and still have healthy digestion. Because it's like a train. The beginning of the train starts in the stomach. You have to break your protein down. You have to assimilate the fats and all the stuff. You're breaking all the stuff down. You're assimilating the food. You can't take whole food and get it into the blood. It has to be broken down into the particles. The stomach is the most critical. It's the beginning of this process. And if you start taking a drug that reduces acid, you're reducing digestion in general. Okay, so now we've got the food, and let's take me. I haven't been on any antacids, and I eat my salad with a piece of chicken. Okay, and the food is supposed to sit in there somewhere between 30 minutes and an hour to hour and a half, depending on how much acid you have in your stomach. And the pH then finally gets down to 2.5, and it's done its job, it's blended. And now it's time to open up the bottom sphincter, to let it out into the small intestine, where you absorb the nutrients. Okay? So we're going to let it out. Well, you folks that are on H2 blockers, your food sits there a whole long time. Sometimes all day. People say, oh, I'm not hungry. I ate this morning and I don't want to eat. That's because their food is still sitting in their stomach. Because they don't have the digestive enzymes to break it down and open up the sphincter. So then it goes down, and eventually the stomach gets sick of it and it dumps it into the small intestine, and it's not digested. Okay? So then it gets into the small intestine, and then we're sitting there, and the pancreas has its work to do. It has to produce a bunch of enzymes, lipase, amylase. Those are the enzymes that break down the carbohydrates, the fats, the proteins, and takes the micronutrients out of the food and absorbs it. The small intestine absorbs 80% of our nutrition. Okay, now I'm going to get back on my soapbox for a second. How many people know somebody that has had gastric bypass? Okay, what do? They either make the stomach too small, or they take out the jejunum, or they reduce the size of the absorption. Like what? Honestly, my God, I cannot believe that this is legal in this country. They're taking out the part of the digestion system that absorbs your nutrients. It's malpractice. I don't care what you say. When you're not absorbing food and you don't have digestive ability to absorb nutrients, you are going to get disease. You are going to get cancer because you don't have any nutrients in your system. You're not absorbing the nutrients into your system. Okay, so then we're in the small intestine, and let's say you have healthy digestion, and you take the enzymes, and you take the, we'll move down a slide here. I'll get back to that in a second. The digestion tract then moves into the small intestine, and that's where you're absorbing. And if you don't have the enzymes to be doing this job, your ability to break down and assimilate the food products. So the small intestine is where a lot of micronutrient, remember we talked about that earlier, the magnesium, the B vitamins, the calcium, the magnesiums, those kind of things. Those are all absorbed mainly in the jejunum and the duodenum. Okay? And so when you don't have that capacity to assimilate and break the food down into small enough particles to get it across the gut, guess what's happening? You're getting nutritionally deficient. And we live in one of the most food-rich countries in the world, right? And I am telling you, the bulk of the people have nutritional deficiencies. Children in particular, because they're eating really, I was going to use a swear word there. My kid is in the back of the room. It's not like he hasn't heard that. But nutritionally deficiencies because they're not digesting and assimilating their foods. Right? You have to be able to assimilate and get the food across the gut. Or what starts happening? Remember that rain barrel we talked about? All the biochemical pathways that are required for hormone production, immune function, liver detoxification, on and on and on. That's why I said I can't tell you how hard it was for me to pick the slides for the show because there's so much to tell you. Digestion is essential And I'm telling you, the bulk of my patients have some form. I work on everybody's digestion when they come into my office. The small intestine, as I said, it produces most of the things, and it has a really hard job. It has to discern what goes into the blood supply and what stays in the gut. Is it toxic? Is it harmful to our bodies? Or is it not? This is where autoimmune diseases start in here. Because these villi, when you have gluten issues and celiac, these villi here in this picture start getting less and less. You have less absorption surfaces. You have less ability to absorb food. Okay? And so when you have less ability to absorb food, you're going to have less. It's called leaky gut syndrome. And so this is what happens when you start getting malabsorption and you get whole particles in the system that up in here, this is your food in large particles. It's supposed to be these tiny little particles, and they go through this area where it's called the gap junction. Okay, this is the discerning, the wall. This is the wall on the Mexico border, right? Who's coming in and who's not. We're going to build that wall up, right? This is what's happening right now, according to our administration. Got to build that wall. Okay. I had to get one little shot in there. Okay, so what happens is if you're not breaking it down from an enzymatic standpoint, you're having these very large particles end up in the blood supply. That causes autoimmune disease. That causes an immune reaction. And that's another topic. I'd love to talk to you about that, but I don't have time. So this is what happens in the gut when you start malfunctioning. You get under a lot of stress. Cortisol tears this lining down. Vitamin D, which most of us are vitamin D deficient in here because we live in a state that doesn't get any sunshine for the bulk of the year. And so vitamin D controls this gap junction. I think my next slide here has it on there. Maybe not. So this, I thought I had a different slide in here, but this in here, there's this little thing called zonulin. And it's like a little rubber binder that holds these cells together. And it's controlled by vitamin D. And if you're vitamin D deficient, you're going to have leaky gut. There's no way of getting around it. So 80% of the population in Minnesota is going to have leaky gut or some form of it. That's why the autoimmune and MS and all of the autoimmune conditions are so high in this part of the country, because we get leaky gut in this part of the country because we're vitamin D deficient because we don't get any sunshine. And when you go in for your physical for the year, they don't test your vitamin D. How critical. This is a hormone that controls so many things in your body. Vitamin D. I mean, and it causes this problem. The gaps keep getting wider, and their ability to digest food and let food through the gut is getting wider and wider. Yeah?
A lot of insurance companies now won't pay for vitamin D testing anymore because they think it's a cheap fix to go and buy vitamin D. So now they won't pay for it. And African Americans are not paying that much for it.
What she said is that a lot of insurance companies now won't pay for vitamin D testing. And so, of course, if they don't pay for it, they don't run it.
Unless you've had demonstrated deficiency.
Yeah, so again, this is the disease model where you have to have the disease to have it tested, right? And everybody in my office gets tested. So intestinal permeability is a big issue. It's causing a lot of diseases that I lecture about, autoimmune being one of them. Because when you're assimilating food into the blood system and the immune system, it's responding from an immune response, and it's causing autoimmune function issues. Here's a leaky gut test that you can test if you have. I don't do this very often because you can tell when people have leaky gut. This is digestive issues. This was me. Our vulnerability, when you have low hydrochloric acid, or you're vulnerable to having not good digestive enzymes and a healthy bacteria, good gut, bad gut deal, the ugly guys get attached. And the statistics on parasite infection is that by the year 2020, which is like 2 years from now, 50% of our population will have some form of parasite or pathological thing growing in their gut that's causing malabsorption issues and health issues. And so this is becoming a bigger and bigger field. And the other issue that's becoming a problem is that the host, us, our immune systems, 80% of your immune system is found in your gut. 80%. And so when you have gut issues, you have compromised immune function. And one of the things that we have gotten real cheeky about or something is that we've been writing out prescriptions for antibiotics for a number of years now that destroy the lining of our gut and our immune system inside our gut. We know that. They've been overprescribing for a long time. It's caused a disruption in the natural balance of the gut, which compromises the immune function in the gut, which leaves the host open for a whole host of things to get attached and establish themselves in the gut. So this is becoming a bigger and bigger problem as we proceed through weeding through this antibiotic, what would I call it, epidemic. You know, I'm not saying we shouldn't use antibiotics, and if they want to use them, they should be using them in injection form. They're a very valuable tool. But when you start taking them routinely through an oral route, it's causing this problem to get worse and worse and worse, which disrupts your ability to absorb. It absorbs your nutrients and your status. This is what was happening to me. I was chronically ill. I thought I was dying. That's how sick I was. Here's the test that I use in my system to look at the functionality of the gut. So it's called a CDSA. And a CDSA is a comprehensive stool analysis, and it's required to understand the functions, the digestion process, how well your body is absorbing, what the metabolic process inside your gut is, and the microbiology. This is a limited test. You can get more extensive tests, but this is a screening tool to determine what's happening inside the gut and how it's functioning. It is essential if you have a gut problem to get a CDSA. Immune system, the gut is under fire with all the toxins and the challenges in responding to the pathogens and responding to the antigens and the unnatural flora. So the good bacteria should roughly be 4 inches of flora on the inside of your gut with good bacteria. So things that we do like kombucha and yogurts and things like that that have the good bacteria that we've gotten away from eating really restore the gut function and restore that lining to protect from pathological adhesion to the gut. And so it's really significant that we understand that if you don't have proper biochemistry inside the gut, you're going to have inflammation. And what is this called? IBS, Crohn's disease, ulcerative colitis. What label do you want to put on this? Okay, those things are inflammatory, right? The doctor puts you on steroids. Okay? Are the steroids fixing the problem? There's that thing going on again. They're not. They're reducing the inflammation temporarily, but they're not getting rid of the pathological problem underneath. Let's say you're eating gluten, and you're gluten intolerant, or you're sensitive, or you're celiac. That's causing inflammation and destruction in the gut, right? And so if you don't fix the underlying cause, what's the steroid going to do for you long term? It's causing adrenal issues. It's causing hormone issues, brain issues. It's temporarily giving you relief from the diarrhea, right? But that's not solving your problem, and it's causing more health issues. So an imbalance in the immune system, these are the things that are going to be seen in an inflammatory and an immune balance gut issue. Okay, well, how many times have you been to your oncologist where they've asked you about your gut? Okay, how many times? Okay, Crohn's disease, irritable bowel. Okay, how about if you're a diabetic? Have they asked you about your gut? I don't think so. So these things are really important to understand, that when you have immune dysregulation and digestive issue problems, you're looking at a whole host of problems. And this problem, when you get hyperimmunity where the immune system is overactive when you get a whole host of problems, this is hyperimmunity, this is autoimmune diseases, this is hypoimmunity. Remember what I said, Th1 and Th2? Th2 is hyperimmunity, Th1 is hypoimmunity. This is what's happening. And these are the diseases that are caused by that. Here's a laboratory testing that we do in CDSAs to determine how much inflammation you have and whether it's cancer causing. Secretory IgA is the immune function inside your gut, and it tells you how well it's working. Here's the 5 R's that we learn in functional medicine, how to repair and restore the gut. So you have to remove anything that's causing problems. Parasites, bad foods, all of those things. You have to do that first. I don't care what you give the patient, whether you go to your medical doctor, you go to a naturopath, you go to somebody like me, a functional medicine practitioner. I can give you all the things. I just got an email from a patient. She'd been on my supplements for about 3 weeks, and she sent me a nastogram saying, this shit's not working. Right? And so I had my secretary basically call her and say, well, what have you been doing? Like, what's your diet been like, and what's going on with that? And she listed a few things and, is not compliant with the diet. If you don't remove, I don't care what I do, it's not going to work. Okay? I'm good, but I'm not that good. Right? I can't fix the problem if you're eating gluten and you're gluten intolerant. I can give you all the enzymes and anti-inflammatories, but if you're insulting your gut every day, all day long, you're going to have problems, and I don't care what you do. Right? You have to replace. You have to get the enzymes, the hydrochloric acid, the bile acids, all the things that make the gut functional working correctly. Okay? You have to re-inoculate. This is the beneficial bacteria that you hear about, the Activia, right, on TV. That thing doesn't have an ounce of bacteria in it by the time you eat it. Okay, repair. You got to build that lining up and fix the cells. Fix the gap junction, get the vitamin D fixed, build that lining up, give the body's ability to heal the gut. The gut cells heal every 4 days. It's very reparative. And so you got to repair. Now I do these simultaneously. They're not separate, like in a sequence. And then you rebalance. You talk to the patient about sleep. You talk about exercise and movement. You talk about healthy eating and all of these. This is required for treatment of the gastrointestinal tract. You cannot fix it. I don't care what diagnosis you have. I don't care if you have colon cancer. I don't care. You have to go through this process or you're not going to fix the GI tract. Yeah?
Do you have a quick suggestion for the amount of vitamin D a person should take?
It's going to depend on how low you are. And then typically what I do, she asked, how much vitamin D? Oh, I think the RDA might be like 400 or something like that. What is it, 800? Okay, they went up to 800. Woo, yes! So typically, if I'm seeing a patient that has been taking vitamin D or hasn't, and they have a level of 30-ish somewhere, my target goal for vitamin D in blood is between 60 and 70. If you have MS, autoimmune, I might go up to 80. I never go over 90, okay? And so it should be. I'll talk about that in a second. So what happens if you've had your blood test and you've convinced your medical doctor to test it for you, and your levels are below 30, you're going to probably need 10,000 IUs for probably 6 to 8 weeks. And then you'd retest it again and probably drop your dose down to 5,000. I've been up as high as 20 when I have cancer patients and things like that. It's immune regulating. And so it's kind of dose dependent based on your blood values and how far you have to go. And you want to retest your blood values with vitamin D to make sure you're not getting excessive. You want to use D3, which is the bioactive form, and you want to be retested regularly on how much to take. Wintertime tends to be that you need a little bit more than summertime, especially if you're outside. But frankly, you need about 80% of your body uncovered to get enough vitamin D conversion. So we don't get a lot, and then we lather sun condition. At my age, you don't cover 80% of your body. Anyway, so vitamin D is one of those things that I retest and retest until I find the right dose for the patient. And the test isn't that expensive. So this is a specific condition called GERD. Everybody has heard of it. The medical treatment for GERD is Prilosec or the H2 blockers. And most of these conditions, they need to change their diet. In my opinion, it's partially an inflammatory autoimmune condition that needs to be treated accordingly with dietary changes, reducing coffee, mint, chocolate, the things that weaken the sphincter to allow the acid up into the esophagus need to be removed. It's the first thing that you do. And then you get the diet under control. And then eventually I give them acid. Isn't that counterproductive? Like they're on antacids, Prilosec. And then they are taking this stuff to reduce the stomach acid. And I'm telling you, there's very, very, very few people that have too much acid. The body doesn't let your stomach make too much acid. It's got controls in it. It's just not meant to do that. It's not going rogue and making all this acid, it's just a weird notion. I don't understand how it ever got going. You know how that got going. So you need adequate levels of acid, and people with GERD tend to have really low acid level, and their problem is not too much acid, it's too little acid. And you have to fix the sphincter and get it to close. It's a tricky business, because if you give them acid, they start refluxing the acid, and they go, oh my God, I'm so much worse. So it's a little bit of a dance to try to fix these. Here's the pharmaceutical companies. And what they've done. This is how we got to the notion that we have too much acid. This is on stores all around you. We don't have too much acid, we have too little acid. Here's some treatment for it, for GERD. Food is the best medicine. You want to live and eat by these rules. And you can read those, that's why I put them in there. I want to talk about water. You need to drink half your body weight in ounces of water per day to prevent dehydration. Half of your body weight in ounces of water a day. It's essential. Okay, this is my conclusion. I've got 5 minutes. The underlying cause of disease is using a system-oriented approach and engaging in both patient and physician in a therapeutic partnership. It's essential in functional medicine. I make people fill out this little questionnaire, and it has this little question that says, do you rely on your doctor to make you well? And if the patient says yes, they don't become my patient. Because it's not my responsibility to make you well, it's my responsibility to educate you on how to get well, and it's your responsibility to choose wellness. I'm not here to fix you, I'm not here to fix anything, and functional medicine isn't here to fix you. It's here to educate you to make better choices and know how to care for yourself. This is a patient-centered doctor-patient relationship. It's essential, because without that, you don't have health care. You have sick care. Thank you. Functional medicine addresses the whole person. Man, isn't it nice to be seen? Right? The whole thing. Not just your thyroid. You want to be looked at, the whole thing, right? You want to be seen. We all want to be seen. And I believe that as medicine, we need to see our patients. We need to look at our patients. We need to look at the biochemistry. We need to look at them as a whole. It's essential. It's how we get back to health and kindness and wellness. And without it, you just can't have health. We're living in a sick model. You can go away and say, I don't work in healthcare, I work in sick care. Because that's the model that has been set up for us. Is it our fault that it's that way? I'm not trying to bash what's happening. It's a system that has gotten out of control. It's gotten too big, and we don't see our patients. Okay, so what do we need to do from a functional medicine standpoint? This was a medical doctor that wrote this. The acute care approach to medicine has lacked the proper methodology and tools to prevent and treat chronic complex diseases in individuals in most cases. It does not take into account the unique genetic makeup in each individual or factors such environmental exposures of toxins and aspects of today's lifestyle that have direct influence on rising the chronic diseases in modern medicine today. That's why functional medicine is going to be the future, to help the disease process and lower the cost of our healthcare system. Our healthcare system is going to bankrupt our country. It's going to bankrupt our country. You cannot continue to treat disease and give end of disease process treatment. It's extremely expensive. If you go back and you fix the digestion in the beginning and you stop the nutritional deficiencies, you've prevented the disease. You eat healthy. You teach patients to eat healthy. It prevents disease. It lowers the cost. It's essential. And I have never been invited to sit on a panel about how to fix healthcare. Never once. They wouldn't want me. So most physicians are not adequately trained to assess the underlying cause, complex chronic disease, and apply strategies such as nutrition, diet, exercise to both treat and prevent disease and illness in our patients. And that's the foundation. You can't fix disease if you don't understand the biochemistry and how to fix it. And I'm pretty sure that there isn't anybody in this room that's gone to their medical doctor and they've pulled out that chart that I showed you. And I do it all the time. I'm out here lecturing, and I lecture at least once a month because I'm here to passionately educate people about the choice they get to have. It's essential for me to be here. I have so much knowledge inside myself, it's bursting out. Because I want everybody to be able to make their decisions about their health. It's how passionate I am about it. And we have a responsibility to ourselves to choose that and to prevent the disease and not be a burden on the system. So this is, as we talked about, this is how functional medicine differs from Western medicine. And I'm going to leave you with this one. In fact, I am certain that there has never been a doctor anywhere at any time in any country at any period in history that has ever healed anything. Each person is a healer within. And we need to support that, we need to nourish that, and we need to provide the information to the people that we love and care about in ourselves to self-heal. That's what functional medicine is about. I appreciate being part of this group. I'm honored, and I hope that I have provided enough information. If anybody wants to be part of our website, our newsletter to know when our next talks are, there's a sign-up sheet that's probably come around, I don't know. Elsie and a couple people are behind that will be more than willing. Our website has a lot of the information. I'm so thankful for you all being here and coming out and listening, and I wish you all good health.